Stone with JCPS Health Services, and I want to talk a little bit about personal protective equipment, COVID-19, and students with special health care needs. The overall approach is to minimize the risk of infection while meeting the needs of children and youth with special health care needs. So COVID-19 or coronavirus is an illness that's caused by a virus that's spread from person to person. This particular coronavirus is spread mainly through respiratory droplets and short-range aerosols when an infected person coughs, sneezes, or talks in close proximity to others. Another way it's thought that COVID-19 can be spread is by touching infected surfaces or objects and then touching your eyes, nose, or mouth. Although it's not as likely to be a risk of transmission, it's still something to consider when talking about preventing spread and using personal protective equipment. So mitigation factors are those things that can help mitigate or reduce the risk of being exposed to COVID-19. And the more of these measures that we implement, the less likely that transmission will take place. And so the factors primarily that we are enacting in schools are social distancing, the use of cloth face coverings, policies and personal protective equipment, screening and school exclusion, sanitation and environmental factors, and contact tracing. So with social distancing, 6 feet of social distance should be maintained at all times as much as possible, and this is one of the primary ways to prevent the spread of COVID-19. School plans currently include social distancing, and staff will need to consider individual classroom needs when looking at implementation within the schools. Now, cloth face coverings are expected for all students and staff unless you're eating or drinking or there is a medical waiver on file. And there are additional personal protective equipment needs for varying circumstances, which we will discuss. Screening and school exclusion. Temperature checks are the primary screening method that will be utilized with students. Staff health checks should be completed each day, and staff will actually have a health screening questionnaire. Students will have temperature checks when they arrive at school. And anyone with a temperature greater than 100.4 will be excluded from school. But schools need to have a plan for rechecking a temperature if it's elevated once the student has rested in a cooler environment. These thermometers are surface thermometers, and so if somebody is hot and sweaty, or if somebody's been in a vehicle with the heat blasting on them, they'll have a falsely elevated reading when you first check with a surface thermometer. So if a student has an elevated temperature, you'll want to do a recheck after they rest in a cooler spot. But students can return to school once they've been fever-free for 24 hours. As far as sanitation and environmental factors, hand hygiene is very important. So hand washing and the use of hand sanitizer is very important. High-touch areas should have extra cleaning. And then schools have plans in place related to cleaning and disinfecting. When students or staff report a positive case of COVID-19, then they'll follow the JCPS contact tracing plan. Every school has designated a healthy at school officer, and that is where cases will be reported. Every school also has contact tracing staff assigned who will do contact tracing in partnership with our district health services office and Louisville Metro Department of Public Health and Wellness. And again, to minimize, though, the risk of exposure in the environment, all these measures, these mitigating factors work together to help reduce the risk of transmission of COVID-19. So personal protective equipment should be used when the risk of exposure is higher. So again, nearly all students 2 and older can wear cloth face coverings that securely cover the nose and mouth. Practice and modeling use of these face coverings will increase success, and staff should use additional personal protective equipment for procedures that may increase their risk for exposure. So students with asthma. If you're caring for a student with asthma, the personal protective equipment needed are a face mask, mask and gloves if you are providing assistance for the student to use an inhaler, and the student can be more than 6 feet away from the person who's helping. A mask, gloves, or face shield should be used if you will directly be working with that student when that inhaler is being utilized. If a nebulizer machine or nebulizer compressor is being used because the student can't use an inhaler, then also eye protection needs to be added to the personal protective equipment, because nebulizer compressors actually create an aerosol, and that is a risk for transmission of COVID-19. So additional personal protective equipment is needed. Most students will have an inhaler, and an inhaler itself is a lower risk than if they're using a nebulizer. So again, when the student self-administers the inhaler, the student should stand 6 feet away from other people. Inhalers that are stored in the nurses or health officer classroom should be stored in paper bags when possible. And then, of course, in JCPS, we have stock albuterol inhalers, and those should be cleaned after each use per the directions on the package. Students should only use a nebulizer when it's medically necessary. If a student must use a nebulizer, then only the student and one staff member should be in the room. And staff members will need to wear gloves, a mask, which could be surgical or medical mask, or should be, and they should wear eye protection. And so if an employee puts a face shield on over the mask, that will cover the eyes, and that can be, that counts as eye protection, that is protecting the eyes. After the nebulizer treatment is administered, then the room will need to be cleaned. Nebulizer parts should be cleaned with dish soap and water after each use and allowed to air dry. And if a student with asthma cannot wear a mask for medical reasons, then they'll need to have a statement from their healthcare provider or that medical waiver on file. And this is determined on an individual basis. So now we'll talk about autism. For students with autism, staff will need to be wearing a mask at all times unless they're actively eating or drinking. The student should wear a mask only if they're able to do so. The student does not need to wear gloves. Again, for a student without a mask, they would need to have a mask waiver on file, although an ARC can also make that determination. Students with cerebral palsy. Again, staff will need to wear a mask. It's expected at all times. If a student's in a wheelchair and requires position changes, then staff should wear a mask, gloves, and a face shield when positioning. And that mask, again, should be a surgical or medical mask if they're going to be up close to the student. And the student should wear a mask if they're able to do so, but the student does not need to wear gloves. For diabetes, staff, again, should wear a mask at all times unless there's a medical exemption on file. If staff will be performing blood sugar checks or giving insulin, then staff will need a mask, which should be a medical mask, gloves, and a face shield for the procedure, because again, they'll be in close proximity to that student. Remember, these students may need to have a private area to check their blood sugar levels and give insulin. If the student's comfortable with doing this in the classroom, then an area should be provided. The nurse may need to work with trained staff somewhere other than the health office in order to avoid exposure to ill students. So every school has a designated isolation area, and that is typically going to be someplace other than the health office. But again, just be mindful, however those plans are designed in the school, to keep the well students away from any students who may be having symptoms. Students who are immunocompromised or whose immune systems may not be fully functioning, staff should be using a mask at all times unless, again, there's a medical exemption on file. There may be times when students are unable to attend in-person school because of being immunocompromised, and a healthcare provider statement should be on file. Accommodations should be made to allow instruction at home. Again, that would all be need to be worked out based on the usual policies and procedures for these things within JCPS. But you may have students that have accommodations that say they need to wear N95 masks to school as an additional level of protection. So that might be something that you see. For students with lung or respiratory disorders, again, staff should wear masks. They will wear gloves, gown, and face shields if they're in close proximity to students. If a student has to be suctioned, then staff should wear an N95 mask or K95, gloves, gown, and eye protection, or a medical face mask during suctioning. Suctioning should be done away from other students and staff, and the area should be cleaned after the procedure. And if the student has a nurse assigned, then a space should be available in the classroom and on the bus for the nurse. For students with migraine headaches, again, staff will need to wear a mask unless there's a waiver on file. And students may have an accommodation in an IEP or 504 plan that allows them to rest when they're experiencing a migraine headache. And this should be someplace outside of where sick students are being outside of an isolation area where you would have anybody who is sick or symptomatic. For students with seizures, again, masks, gloves, and face shield if staff are up close, in close proximity to a student who is having a seizure. And again, if a student is seizing, then other students should be cleared from the room to allow for privacy. For sickle cell anemia, we have a number of students in the district who have sickle cell, and masks, again, are the standard expectation for everybody unless there's an exception to that. But just know that students with sickle cell may have accommodations in their plans to rest, and this should be done in a space outside of where there are sick students. But it's also very important to remember that if a child with sickle cell anemia develops a fever, the parent or guardian needs to be notified immediately because this can be very serious in relation to care for their sickle cell. For students with spina bifida, staff should again be wearing a mask. If a student's in a wheelchair and requires position changes, then staff should have a medical mask, gloves, and a face shield when they're up close to that student for positioning. And the student should wear a mask if they're able to do so. The student does not need to wear gloves. So for particular procedures, for those students who might be catheterized or having assistance with hygiene at school, staff should wear a medical mask, gloves, and face shields when completing a procedure on a student. Gowns may be used depending on the circumstances. Gowns are indicated when there's a reasonable expectation of splashing occurring. Students should wear a mask if they're able to do so. Students do not need to wear gloves. For toileting, assistance, and diapering, when the staff is going to be up close to a student, then they need to have a medical mask, gloves, and face shields when performing a procedure. Gowns are recommended, as I said, if there's a reasonable expectation that saliva or other body fluids could come into contact with an employee's clothing. Staff, the student should only wear a mask if they're able to do so, and students do not need to wear gloves. For feeding assistance, again, staff would be up close to a student, and so that would require a medical mask, gloves, and face shields when they're completing a task. And then other things to consider when staff are working with students who are likely to bite or spit. Staff may consider wearing long sleeves or jackets over their clothing. Students should wear a mask only if they're able to do so, and the student does not need to wear gloves. For G-tubes and medicines or feeding, again, when up close to a student, you want to make sure you've got a medical mask on, use of gloves and face shields if that person, when a procedure is actually being done. And then same, if a student is likely to bite or spit, or the procedure is likely to involve splashing, then gowns or covering of the clothes is indicated. The student should only wear a mask if they're able to do so, and students don't typically need to wear gloves. When providing hand-over-hand assistance for tasks, staff will be up close to students, and so again, when up close, we want to make sure that you have a medical mask, you've got gloves and a face shield for providing that hand-over-hand assist. And if working with students who are likely to bite or spit, consider wearing long sleeves or jackets over your clothing. Students will only need a mask if they're able to wear one, and they do not need to wear gloves. For occupational therapists who are in close proximity again to students, it's that medical mask, gloves, gown, and face shields. Make sure each student has student-specific adapted tools and devices, and these items are routinely cleaned per protocol. Consider assessing students in a group with other providers, and if seeing students in a small group, try and keep those small groups consistent so it's the same group of students that are together each time, and that's really for contact tracing purposes, knowing what child is with who and when. Same guidelines for physical therapists, that medical mask, gloves, gown, face shields when in close proximity. Consider using a clear face mask and make sure that there's appropriate cleaning of supplies in between sessions and keeping those groups consistent. For speech therapists, clear mask, face shield, and gloves. There are masks that have been ordered, the schools can order, that are clear, so to support and facilitate the work that speech therapists are doing. You want to try and keep your groups consistent so that you know what students were with what other students. It's the concept of keeping those students in pods. If possible, you can use a desktop screen between the therapist and student, but a face shield that you wear over your mask can provide that same type of barrier protection that you're looking for, and face shields are available for each employee. Those the areas should be cleaned between students. Face shields can be cleaned and reused. And again, keep your groups consistent as much as possible to facilitate the concept of pods and contact tracing. So some special circumstances for kids who are biting and spitting, as we've talked about, a medical grade mask, face shield, and gloves, and a gown when working with students who are likely to bite or spit. Gowns are recommended, again, when there's a reasonable expectation that saliva or other body fluids can come into contact with your clothes. That is when a gown would be indicated. If you determine that a physical restraint or hold will be indicated for a student, it's important to know what personal protective equipment is needed. There is a document that gives guidance on the use of personal protective equipment during restraint, and that is the Kentucky Department of Education guidance on safe crisis management. And it says, some students may require the use of physical restraint to prevent harm to the student or others. In the case of physical restraint, staff should use gloves, surgical gowns, masks, and face shields. If a core team member has time to don the appropriate PPE prior to the physical restraint, this is preferable. However, there may be cases where safety is an issue and putting on PPE prior to the restraint is not possible. In this case, protect the student first, then have someone who's wearing appropriate PPE take over as soon as possible. If the personal protective equipment is accidentally removed during the physical restraint, the team member should be replaced by another core team member wearing appropriate PPE. Schools should consider assigning a core team member to assist with PPE needs during the physical restraint. And this is from the Kentucky Department of Education COVID-19 Guidance 2.0, and that can be found on page 21. So physical restraints and holds require two different precaution types, and that's contact type, so that's contact with blood or body fluids when you anticipate that, and then droplet, which is the droplets that can come from the mouth, and that would require mask, face shield, and gown. Again, so, as I said, ensure that staff put on gown with long sleeves, ensure that staff wear disposable gloves, cloth face coverings, face shields, and long sleeves, ensure that only staff required for safely restraining the student are involved. One additional staff member should monitor and address PPE needs for those involved in the physical holding in the event that the PPE needs to be adjusted. Keep hands clear of the eyes, mouth, nose of self and others. Relieve first responders as soon as possible if they're not wearing PPE, and avoid long and extended physical holds. Remove of and dispose or clean the PPE immediately after the physical hold or restraint. Avoid touching your face and limit contact with hard surfaces before you wash your hands. And after removing PPE, always wash your hands with soap and water for at least 20 seconds. If a hold must be implemented without PPE, another staff member, again, should don the appropriate PPE and then step in to assist. And consider having additional change of clothes at the workplace for staff. PPE is stocked at the central warehouse, and schools should order following standard processes. There have been shipments of PPE sent out, distributed out to schools, and that process is ongoing. And again, masks, gowns, gloves, clear masks, thermometers, face shields, shoe covers, those items are ordered and stocked. If you ever have any questions about PPE and what PPE is indicated, please feel free to give us a call at Health Services 485-3387.